Social and Psychological Implications of Infertility by Stephanie Gomez. Infertility. There are two types of infertility that one may suffer from. We have primary infertility, which is the inability of a couple to conceive a child after at least 1 year of active, unprotected sexual relation without contraceptives. Or secondary infertility, which is the inability to conceive after having once conceived or to maintain a pregnancy long enough to deliver a viable infant. Infertility represents a major crisis for most couples, bearing social and psychological effects on both partners. Those who struggle with infertility experience loss in ways that affect them as individuals, family members, members as society as a whole, and suffer mental health issues. Social impact of infertility include the lost experience of pregnancy and birth, the loss of opportunity to pass on family genetics, the loss of a chance to contribute to the next generation, the loss of chance to be a parent, and for those parents who wish their children would conceive, they lose the chance of becoming a grandparent. They lose the chance of family stability, and they also experience the loss of work productivity. For the psychological impact, the initial is going to be shocked because fertility and conception is viewed as natural. They are going to be shocked that they can't conceive. They're going to have guilt, isolation. They also have stress over infertility issues. They may experience depression. They also have low self-esteem and low self-worth and anxiety. Those with infertility struggle to focus on anything other than conceiving a child. They have tension in a relationship and they tend to blame each other. They have resentment, anger, and are judgmental. They have a loss of interest in most activities. They have feelings of worthlessness, guilt, and shame. They have a feeling that they get physically agitated. They have feelings of hopelessness, and they isolate themselves to avoid emotional pain. It is important to address the social and psychological needs of infertility of both men and women. Counseling can help increase coping strategies and to provide help with making decisions. Ideally, counseling should begin before infertility treatments. Interpersonal therapy focuses on improving relationships and resolve conflicts with others. Cognitive behavioral therapy identifies and tries to change unhealthy thought patterns and behavior patterns. Relaxation techniques. Because infertility and its treatments often cause stress, relaxation techniques are often recommended, such as mindful meditation, deep breathing, guided imagery, and yoga help promote stress management. A psychiatrist may be needed for some persons who have significant symptoms of anxiety and depression. These effects can further hinder a couple's inability to conceive. Physical activity can help lower stress and boost fertility, but the right amount is important. Exercising too vigorously can lower the chance of conceiving. However, working out throughout the week for 1 to 5 hours in activities such as walking can raise the chances of conception. Weight watch. Emotional eating is the downfall of stress. Overweight and obesity makes it harder to become pregnant as well as stay pregnant. It is tempting to load up on processed and sugar foods when stressed. However, healthier diets can help improve chances of conceiving. Eat more foods that contain whole grains, omega-3 fatty acids such as shrimp, salmon, and catfish. It is recommended to eat 12 ounces of a variety of these fish at least a week, which is an average of 2 meals. Here are 10 coping tips to deal with infertility. Acknowledge feelings. Infertility is an emotional journey. Accept these emotions and don't pretend that they don't exist. It's natural to feel grief or loss when you find yourself unable to naturally have children. However, when you don't properly express your feelings, it can build up emotional stress, which can hinder conceiving further. Only when you are honest with your feelings can you properly address your feelings and move forward in a positive way. Always be honest with your partner. It can be easy to build up resentment and anger toward your partner when you can't conceive naturally. These feelings are normal, but again, it is important to overcome them. Your partner is struggling with you, and it is important to remain a strong team throughout this journey. Remember to always be honest with your feelings in a positive and healthy way. When things become difficult, don't be afraid to reach out for help. Speak with a trusted counselor. If you and your partner can't express feelings in a healthy manner, consider speaking to a fertility counselor before you choose a treatment for infertility. Understand your options. Part of dealing with infertility is the feeling of hopelessness and not knowing what to do next. Many professionals can help you understand what your fertility options are. When you have a better understanding of what your options are, the better you are able to understand the steps you need to take. Join infertility support groups. It can become frustrating to hear unhelpful advice for friends and loved ones who don't understand the struggle. Some find it helpful hearing from others who are struggling with infertility also. Find healthy outlets. For emotions, you may not always feel like talking about your emotions with infertility. Other ways to overcome your emotions can include writing in a journal or going for a walk or exercise. Reestablish intimacy with the partner. Intimacy with your partner may feel forced after trying to conceive for so long. This can impact your relationship with them. Reigniting the flame can be beneficial by relieving stress and making yourself feel like you again. Find ways to reconnect with your partner by making them a special meal or drink, or simply holding hands or going on a romantic stroll. Be optimistic but realistic. It is important to remain optimistic and hopeful while giving yourself realistic goals. It is unhealthy to be hopeful that you will become naturally pregnant after being diagnosed with a severe infertility problem. Instead, work with your infertility counselor to understand what is possible in your situation and what you can do to reach those goals. Don't blame yourself. In most situations of infertility, it is not caused by something you did. Rather, it is a combination of genetics and other factors that you can't control. Blaming yourself is not productive to your family building goals. Instead, focus energy on positive steps you can to take to reach those goals. Take care of yourself. The common theme of these tips is self-care. It is important to take care of yourself through this overwhelming journey and overcoming infertility. The healthier and happier you feel, the less debilitating your infertility journey will be for you and your partner. Take time in whatever works best for you when things get tough.